Lata ma'am, you are there?
Sir, Lata madam, I'll promote.
You please promote, no? You please promote. Dipti madam joined? No, no. I think Salome madam also joined. Just let her in also, no? Like, let her be in the panel. Melvin sir, Salome madam also she joined. I think let her.
Sir, I will search them and do, sir. You start, sir.
Yeah, please. Okay, you please start. Sorry.
Good evening to everyone. A warm welcome to everyone who have joined for the second day international webinar. And also a warm welcome is the simplest and most powerful way to make someone feel valued. With this quote, I wanted to start today's session. As we are on day 2 of the international webinar. Today we have two sessions, session 3 and session 4. Session 3 by Ms. Anu Grover ma'am, Director, National Reference Simulation Center, SGT University, Haryana, on research methodology and data collection techniques in nursing. Session 4 by Dr. Amal Raj Anthony, Professor in Biostatistics, Senior Scientist, led Apotex Pharmaceuticals Company, Toronto, Canada, on statistical analysis for research analysis. Today we are going to start a first presentation on research methodology and data collection techniques in nursing by Anu Browerman. Before that, I would like to introduce once again our beloved president, Dr. MP Muthu sir, who has completed a BSc Nursing, BSc Hospital Administration, MBA in Hospital Administration, MSc Nursing from RGHS, PhD honorary from Global Peace University. He has more than 15 years of clinical, teaching, and administrative experience in the field of nursing quality and administration. He has worked as NABH consultant and certified 10 hospitals for NABH entry level and full accreditation. He's been a certified master trainer for simulation-based education from NRSC, New Delhi. He is also certified by NABH for clinical audit. It's my great privilege to invite Dr. MP Muthu sir to introduce our moderator for this session as well as our eminent speaker. Over to you, Muthu sir.
Thank you, ma'am. Thank you for the introduction again. It's my privilege to introduce Anu ma'am and as well as Dr. Prasanna Deshpande sir. First, I'll introduce first moderator, that is today's first session and second and third session. This session, I wanted to moderate. I wanted to request to moderate Dr. Prasanna Deshpande sir, Professor and in-charge principal of SDM Institute of Nursing Science, Hubli. Currently, sir is an in-charge principal of SDM Institute of Nursing Science, and sir is having around 18 years of academic experience in nursing education and specialized in medical and surgical nursing (MSN). And at academic contributions, recognized PG and PhD guide and examined at various universities. And professional roles, members of board studies and IQAS multiple universities. And scholarly achievements, authored at 12 publication in national and international research journals. We welcome you, sir. And I take this opportunity to introduce our eminent first speaker, Ms. Anu Grover, ma'am. Even I had been to 2 times to SCT University for the simulation thing, training. We had a wonderful time, ma'am, actually, with all your team, ma'am. Madam is 11 years of teaching experience, including 4 years of simulation and associate professor at Faculty of Nursing. Master trainer of simulation-based education methodology, trained around 900 nursing faculty across India, abroad, and 35 batches organized by Indian Nursing Council. And master trainer of capacity building of midwifery faculty model 2, trained 655 midwifery faculties across India and abroad in 29 batches organized by Indian Nursing Council in collaboration with UNFPA. Madam is the instructor for American Heart Association certified basic life support and advanced cardiac life support. Training Center Coordinator of International Training Center, SGT University of American Heart Association. Madam is a provider for the advanced cardiac life support by American Academy of family physician. Madam has organized various programs at National Reference Simulation Center like Neonatal Disease Program India, induction training of new nurses in obstetric and gynecology nursing, American Heart Association certified basic life support, compression only life support training for non-teaching and public in community, first aid training for non-teaching staffs of SGT University, attended various workshops and conferences at national and international levels, delivered talk on simulation in various national and international workshops and webinars. Total 17 publications, including the review articles in national and international journals, including Cooper's Index Web of Science. Briefed about simulation methodology to various national and international delegates at the National Reference Simulation Center, SCT University. I take this opportunity to hand over to Anu ma'am. Ma'am, over to you, ma'am.
Yeah, thank you so much for the brief introduction. Hello, Dr. Deshpande as well. So first of all, I would like to thanks for this opportunity to Muthu sir. He approached me and it was a pleasure to accept this invite. And this is a platform where we can discuss many things all together, and we can understand and we can help our students that how we can understand about the research methodology and data collection. And I would like to congratulate the organizing team for arranging these kind of webinars. This is really a great help for the students where they find it interesting and they get lots of knowledge other than the classroom teachings when they are listening the different speakers from the different experiences. So this is a great opportunity for each one of us. So shall I start with my presentation?
Please, ma'am, you can share, ma'am.
Thank you so much. Is it visible to everyone?
Yes, ma'am. Yes, ma'am.
So just to start with my presentation, first of all, I would like to know how much time do you have, sir, for me?
Ma'am,
So
you can take 45 to 50 minutes, ma'am.
All right, I'll take care of that time. Right.
Yes,
So you can just
you.
remind me in between if you feel that I'm taking too much time.
Sure, ma'am. Sure. Thank you. Thank you.
Yeah. So when we talk on the research methodology, it is basically that's very important component which we should look into that when we are planning to have some research and some researcher wants to conduct some of the research components that are covered in research methodology and followed by the data collection techniques. This is very important component of the research methodology. So when I personally feel research methodology is a blueprint or the strategic planning which we do for conducting any kind of research. There can be different kinds of research which I'll be discussing in the presentations in next. So that is very important for everyone to understand that how research methodology help and how it should proceed, what are the overviews and how we should go, what should be our plan, how we can make the blueprint, how we can make the framework, where we can actually help some guidance from our blueprint and from our framework so that our things go in a more structured manner. So when I talk on the research methodology, it has many components in that. So the first important component is research design. So when I talk on the design, it is specifying the type of research I want to conduct. There is it depends, like I want to go for the quantitative one, I want to go for the mixed method, or this is the qualitative one. That totally depends on which research question is with me, what I want to get the answer for, what I'm looking for further for. So this is very, very important for a researcher, that when he's or she is planning to conduct some research, he should have something in his mind that is dependent on what kind of question she is trying to answer. So this is very important to understand what research design is. So when I say research design, it is more on the qualitative, quantitative, which are very common, and mixed method is these days also emerging. Earlier there were more researches, if you find in the reviews of literature, the more researches are more on the quantitative data, but nowadays people and students are more inclined towards the qualitative and the mixed method the most. They're finding it interesting that how they can be more inclined towards the qualitative data as well, how they can more inclined towards the like how they can understand the perspectives of the students, how they can understand the their satisfaction level and many more things in the qualitative. So when I say quantitative, the quantitative is more when we focus on the context and the depth of particular when I talk on the qualitative, it is more on the context that we are taking particularly to understand the depth knowledge. So we want to know the actual perspective of that particular person, that we say qualitative data. This is not quantified, but that is more on the subjective means. When I talk on the quantitative, that is more on the objective means, where I want to, get, or which is more countable, which is more measurable, which can be expressed in by using numbers. So this is very, very important for the person to understand what is the difference in qualitative and quantitative. So when I talk on the qualitative, this is more where we want to know the deep understanding of some phenomena. We want to know the deep understanding of particular thing. We want to get depth of knowledge of that particular idea. So this is more on open-ended approach. When I talk on the quantitative, this is more on the closed-ended approach, but yes, we are quantifying the data in the quantitative. And definitely mixed method is self-explanatory, that when we cover both, we are taking the data, quantifying, and we are understanding their perspectives, understanding their behavior, and understanding the context of that particular phenomenon in that. So when we mix both of them. So coming to the second component in the research methodology, which is very equally important, is research approach. So when I talk on the research approach, it is general strategy which we use, which helps me to get an idea where from I should start, whether if I'm talking on the qualitative one or if I'm talking on the quantitative one. So when I talk on the qualitative, that means I am focusing more where I'm going into in-depth knowledge, where I'm talking on the inductive data the more. So I have some particular thing with me. I have something which I have to make. I have to make some theory out of that thing. So the strategy will be inductive, where I'm going from bottom to top. And when I talk on the inductive one, means I'm going from specific to general. So I have something with me. I want to get into that, what generalization I can make out of it, what specific thing I can make out of it. So that's very, very important for me to understand that what is the approach I'm going to follow, whether I want to go from specific to general, or I have something already generalized and I want to get back to understand what is going from general to specific. So when I'm talking on the inductive, means I have one answer with me, but I want to create the theory out of it. But when I talk on the deductive, that is more, I have so many things with me. When I'm going from top to bottom, there is a general thing, but I want to look into the specific cause behind that. So this is the way we talk on. It is depending on which approach I want to follow. That also depends on the research design as well. So coming to the third component in the research methodology, that is more on the data collection. So this is the topic which is already with me. So I'll be talking much more on the different slides, but this is the way or the technique that how I want to collect my data. So we'll be talking in detail in the next slides. So coming to the fourth one, it is more on the sampling techniques. So now I have my research design with me. Now I'm sure what I want to prove, whether I want to test some theory or whether I want to create some theory or I want to do some testing of hypothesis. So that depends. So now I have already approached to the data collection techniques as well. So now this is the point, who will be my subjects? When I talk on the subjects, means who will be my target people on whom I will be collecting the data. So when I say subjects, that means my samples. So suppose in case I want to conduct a research to understand the satisfaction level of the patients. So who will be my subjects? My subjects will be my patients. So what will be the way how I'm going to choose that subject? Am I going to take the whole subject altogether? I'm going to take all patients in the ward, or I'm going to randomize them. So that depends on what is the kind of strategy I am following to select my participants or my units of a study. That means it can be probability, it can be non-probability. So when I say probability, that means every patient is getting an equal chance to be the part of it, and non-probability, that can be more unbiased, that is going with my own convenience. So it is depending that if I am doing the randomization in the probability sampling, that means more structured way, that every student or every patient depends on what kind of subject I am choosing. So every patient is getting an equal opportunity. So every fifth person who is admitting in the ICU will be my sample. Every 10th person who is admitting in the hospital will be my sample, or every second student who is coming to the university will be my sample. So that depends that every student is getting a chance. So the person who is selecting the student is not biased, and the data will be more structured to collect the samples. Coming to the non-probability, that means it is not the same. It is on the convenience. All 5 patients admitted in ICU are my patients. All 10 patients admitting in the hospital will be my patients, and all 100 students in the college will be my patients. So that is depending on what is the strategy we are opting when we are going for the sampling techniques. So now we are coming to the data analysis. So when I say data analysis, that is more on that how we are going to analyze the data, that what is the way I want to work on that data what I have already collected. So there are procedures how we want to analyze it. The data can be descriptive manner, it can be inferential. So descriptive statistics is there is an inferential statistics is there. So when I say descriptive data, so data means how I want to present my data, that how many women will be there, how many child will be there, how many, I'm talking about one family where I'm collecting the data. So I'm talking about these kind of 100 families where I want to present. So in 100 families, there was 50 women and there was 10 children and there was rest of the men. So this is the way how I want to describe my data. All 50 were under the age of 40, all 10 were under the age of 5. So this is the way how I'm describing my data, how the data is being described. That is the descriptive data analysis. And inferential means when I want to understand, when I want to quantify something, when I want to predict something, that out of 50, that 40 women said they are not happy with the rituals which they follow, and out of 50, 10 were happy because of this is the data which I have to analyze, because I have collected the data from them. Now I am just analyzing the data out of which. So now coming to the next one, the sixth component is tools and techniques. So tools and techniques is more on what is the instrument I'm going to use to gather my data. What is the tool I'm going to use? So when I talk on the instruments, it's very well clear to everyone. Being a nursing students, we know if I want to check the BP level of the patient from morning to evening, twice in a day, so what will be my tool? My tool will be BP apparatus. That is the instrument from which or by which, with what instrument I'm going to gather the data. The instrument can be BP apparatus, the instrument can be, so we say this instrument is not the physical instrument, not the biophysical instrument. These instruments can be your knowledge questionnaire. So I'm collecting the data, assessing the knowledge level of the nursing first year students on the importance of checking the vital signs. So that is my tool will be, my instrument will be knowledge questionnaire. So this is the tools and techniques which we have to follow. That is the component which covers under research methodology. So now seventh one is ethical consideration. So when I talk on the ethical consideration, this is very, very important to ensure that there is no harm which is being to the patients, maybe to the students, to my subjects, that it is ensured that there is ethical standards are being met. The patients are not being suffered because of my interventions. The patients are not being suffered what I'm going to lose about. Coming to the eighth component, that is validity and reliability. So when I talk on the validity, that is like validity is like how trustworthy my data is, how ensuring how accurate data is, and consistency is how many times I'm checking the BP of the patient, this BP instrument is giving me the same result. So point is that if I talk on the validity means if I'm checking the knowledge level of the students, my questions, knowledge level of the students on the importance of PVs, like importance of, let's say same example, importance of vital parameters as a first year. So my instrument or my tool should speak about that these questions are carry the same marks, which tells me about the importance, which is helping me to understand the importance given by the students. And if I'm talking about the reliability means the consistency. If I'm using one BP machine on one patient and same time the same BP machine on the other patient and on the third patient, it is giving the same kind of good results, or it is like the BP, there is not much variation. So let's talk on the weighing scale. If I'm checking my weight on the weighing scale at 9 a.m. on 21st of November, and if I'm doing the same weighing scale I'm using on the like 22nd of November, the first weight it is showing me 70 kgs, the next day it is showing me 90 kgs. So this is not reliable. This is not consistent. Means it is varying on the results. So that is not reliable thing. So coming to the limitations, very important thing to look into the research. that what are the weaknesses, what are the time constraints I could feel, what are the problems I faced, what are the challenges I had during my research. That should also be taken care of. And last but not least is data interpretation. So when I talk on data interpretation, it is more that how I'm going to analyze already what I have analyzed, what is the conclusion I'm going to take. So that is totally dependent on all these things. So research methodology basically include the research design, research approach, data collection, sampling techniques, data analysis, tools and techniques, ethical considerations, validity and reliability, limitations, and data interpretation. So this is one question for everyone in the group, for the students especially. Can you arrange the following words to form a meaningful sentence? And then you can write in the chat box. Can I have the answers in the chat box of, can you arrange this? Are you able to see this?
Yes, ma'am. Everybody can see it, ma'am.
Who is the first person to write in the chat box? So it's written the difference quantitative research, what is qualitative research in and. So do you want to arrange the words to form a meaningful sentence? Could I get some answers, sir? I'm not able to see. Yes, I could get.
What is the
What is the
difference
difference
between
between quantitative
Yeah, ma'am.
and qualitative? Yes, very good. So now,
Yes.
now you can just hold on the question. We'll come back and we'll discuss on the answers in the later, right? So what is the difference between qualitative and quantitative research? Thank you for the answers. So now we are talking about the research methodology. When I talk on the research methodology, it is more we should talk on how it is useful, how it is helpful for me as a researcher. So what I feel when I have a guided strategy and plan with me, I'm more confident on the things, because this research methodology which I'm going to follow, it is replicable and verifiable. So when I say replicable, that means I can create the detailed plan when I want to do the same kind of research, or if other researcher wants to do the same kind of research, they can repeat the same kind of strategy for them. So that's a help. And it is more verifiable, because what are the limitations I could face, what are the challenges I could face, I can express in that, and it has been considered accordingly. So method selection. To ensure that the researcher outcomes are reliable, trustworthy, and free from bias. When you have a strategic plan with you, it is more easier for you to make an idea or get an idea that what is the best method they can choose when they go and repeat the same kind of research further. So this is more valid and unbiased to enable other researcher to repeat the study or confirm its finding. It is confirmed, it is validated, and research planning it's a big help, which is an aid in choosing the suitable methods for data collection and analysis based on the research question. So this is basically a help for the persons if you want to repeat or replicable the same kind of research, and it is a help for the other researcher who want to go according to the same strategy and plan. So now let's first, as we have discussed, what is quantitative. So quantitative is more where we can measure, which we can quantify, where we can predict some answers based on the numbers. So when I talk on the quantitative research designs, the basic major designs are, the first one is descriptive research. So descriptive research, as everybody, it is very much clear that this descriptive research is talking on that describes the characteristics of a person. So that when I talk on the, it is talking on the characteristics of the phenomena. So let's say that it wants to know the preferences of some person. For an example, I want to know the patient satisfaction. It can be in a quantifiable term. So that is what I want to see, that how much is my patient satisfied. So let's take an example that my patient is satisfied more, that is 80% of patients are satisfied with the nursing care and 20% are less satisfied. So this is the way we can quantify. This is just describing the characteristics of the phenomena. It is not we are changing something. We are just observing the way it is happening. That is the descriptive. We want to describe something, express something. So coming to the second one is correlational. So it is, name itself is very much clear, correlational. When you want to see the relationship amongst two or more variables. So when you examine the relation without manipulation of the variables. So variables means that is there is a dependent variable, there is an independent variable. So let me give you little more example or brief on the variables. Variables is, I want to assess the effectiveness of lesson plan on the students' results. So my variables are, my lesson plan is my variable and my results, students' results is my variable. I want to see the results. Whatever lesson plan I am teaching to my students, what is the result and outcomes of that? So I want to understand that. That is what, where I'm not changing anything. I'm just doing the way. I'm observing my first year students, I'm teaching my first year students, then at the end of the first year, I am just checking. So I want to see what is the relation. If I'm taking the class in a planned way, what is the outcome is happening. I'm not doing changes anyway. So there can be 2 or more variables. So I am observing the lesson plan with the effectiveness of lesson plan with the results, along with I want to see the satisfaction of students by the teacher's class through the way of lesson plan. So there are 2 or more variables are being connected. So there was one variable, lesson plan, the other variable was results. Now the third variable I have added is student satisfaction. So now coming to the experimental research, it is again, from the name itself, it is very much clear. What is experiment? When you want to try something, when you want to understand something by changing something. So means you are trying to manipulate. In the correlational, we also examine the relation, but in experimental, we also examine the relation. But in correlation, we are not manipulating, but in experimental, we are manipulating the variables. So when I say manipulation, that means like I want to understand that I am doing the cause and effect. What will happen if I'm giving the lesson plan to my first year students, and what will happen if I'm not giving the lesson plan to my first year students. So that's my manipulation. So I'm keeping 2 groups where I want to see the manipulation. One group I'm giving the intervention, the intervention is lesson plan. The other group I am not giving intervention, the intervention is being holded. So I am making one control group and other one I am keeping the experimental. So I am holding one batch of the students to whom I am not giving the strategic planning for the teaching and learning. So this is the result I want to see. So I am examining the relationship between the lesson plan and with the results, and the other student control group to whom I am not giving the lesson plan and I'm just observing the results. So then I am comparing both the results, whether the lesson plan is effective or it does not make any changes or sense. So when I talk on the experimental research, there are different types of research. One is experimental, we call it true experimental. The other one is quasi-experimental. So that the difference between these two, when I talk on the experiment, as I already told, there are 2 groups. One is control group, one is intervention group. So other than that, control and intervention, we have the randomization. As already we spoke in the methodology of sampling technique, that we have to take the samples with the random selection. I want to give every student equal chance. So we, in a true experimental, we have the randomization, we have the control, and we have the intervention. But in quasi-experimental, it is the same way, but there is lack of randomization. Randomization is not there. There is only control and there is only a intervention. And there is another, the pre-experimental, that is, we are just doing the post-test results. This is pre and post. We are not keeping any control group in that. So in the experimental, there can be control group, there can be randomization, there can be not control group, but there is an effect of what we are implementing with the manipulation of the things. Now coming to the fourth one, it is a longitudinal research. From the name itself, it is again clear that I want to see the results over a long duration. I want to see the changes over a long duration. So let's take an example of longitudinal research, that I want to see that some of the things I want to see, what are the lifestyle changes leading to the adolescent health? What is the lifestyle changes leading to the old age? So I want to observe, let's take the same example of students. I want to observe my first year students. How were they confident in going to the hospital till their last year? What is the changes I could see from the first year to the fourth year? So that is my longitudinal. I'm observing the same subject, the same first year students for the second year, for the third year, and for the fourth year, even during their internship. I want to observe the same subject over a different time changes, over the different trends which are happening. So coming to longitudinal research. After that, there is a cross-sectional. Cross-sectional research is opposite to longitudinal research. So longitudinal, from the name itself, it is clear, long duration. Never forget that. Cross-sectional is just taking at a point, one point of time, that I want to understand what is the exact thing is happening at this point of time. I just don't want to go for the long duration. I just want to see the awareness of the first year students about the importance of vital parameters. I just want to observe only the first year. I just don't want to talk on how they are going to feel it in the second year, how they are going to feel it in the fourth year. I just want to see first year mein what was their attitude towards considering the importance of vital parameters. So that is all about the types of quantitative research design. So moving further, coming to the types of qualitative research design. So when I talk on the qualitative research design, that is, we have many, but I have jotted down. There are a number of research which are happening with the sub headings. The main headings are: one is ethnography research, one is grounded, phenomenology, historical, and action research. So when I talk on the ethnography research, so this is a qualitative research. First, let's repeat what is qualitative research. That is the in-depth knowledge. What is the deep understanding I want to have on the any of the phenomena. I want to understand the perspective of that particular student, that what made him to choose a nursing profession, what is the reason, what is the cause that he's not liking, maybe because this is a common issue with the nursing students. When they go to the first year, they are not much happy with the profession they have been chosen. So this is the kind of understanding, this is the kind of attitude towards nursing I want to see. That's the qualitative data I want to gather. So there are multiple ways of doing that. There are multiple types. So when I talk on the ethnography, this is the method to study or to understand the culture of any community or any social practices. So an ethnography, that is, I want to get a deep understanding that how people live, how people behave and interact with each other. So I want to understand the daily life rituals, social structure. So like, let's say I want to study the structure of one university. I want to study one structure of one class, how students are gelling with each other, how they are behaving, being first years, how they are behaving with each other, how cooperative they are with each other, because they have apart from their families, now they are in hostel first time. So this is the kind of culture, this is the kind of trend I want to have an idea, where I want to see their behavior and how they are interacting. That is called ethnography. That is more named as ethnography. So coming to the grounded is more into the developing theories and models by collecting the data. So that is, I want to develop some theory rather than testing the hypothesis. So when I say testing the hypothesis, that means I want to see if I'm giving the lesson plan to my students knowledge will be more, the results will be more. So my hypothesis, lesson plan is effective for the good results. That's my hypothesis. I want to test, but this is opposite to that, because that is the quantitative data. Here I don't want to test any hypothesis, but I want to create some theory out of that hypothesis. I have the hypothesis proved. Now I want to go from understanding that where I can create that, how I can create that theory. So let's take an example of grounded theory, that where I want to understand how teenagers using social media and its effects on the social interaction, how they are using the social media and how they are interacting with the social people and social gathering, how it is putting impact on that. So I want to create or generate some models and theories out of it, which can be later used for the quantifying that data. So coming to the third one is phenomenology. So when I talk on the phenomenology, that is more on investigating a phenomena by interpreting the experiences. I want to investigate some phenomena. I want to see the live experiences of the persons, that how are they feeling after they recovered from the COVID, how the family is feeling after they have lost their child, how the parents are feeling after they have lost their son. So I want to understand, I want to get an exposure, what is their experience if the patients are living in with some chronic pain and the patients are with cancer disease. So I want to have an idea that what is their experience of living with the cancer, and what is their experience of living after losing their partners or kids or family or whatever the problems they have been gone. So I want to know the lived experiences of the people. I want to know the live experience of the people who have been in a place where tsunami has just gone by. So this is the what I want to know, the life experiences of the people. That is called phenomenology. I want to investigate the phenomena by interpreting their experience. How are they feeling after? It can be a happy moment, it can be a sad moment. So I just want to know the life experience of that particular person. So coming to the history, so when I talk on the historical data, this is more on when I want to understand what has happened in the past. From the name itself, it is again clear. It is little tricky to remember ethnography, grounded, and phenomenology. When you talk on phenomenology, it is very much clear where I want to understand the phenomena of their experience. Grounded is when I want to make some ground or some base to develop theories, and ethnography where I talk on the ethics, culture, and their morals. So I think it will be very easy for you to recall ethnography related to ethics and culture, grounded where you want to make some base to generate the theories, that is ground, and phenomenology when you want to understand the phenomena. So I think it will be easy for you to grab this vocabulary or terminology, to be honest. So coming to the historical and action research. So when I talk on the historical, it is again from the name itself, it is more clear. So historical is you understand what has happened and what was the impact. What has happened in the past and how it impacted the present and how it may impact the future. So this is I want to understand. What was the history? What happened when there is a World War II happened? How World War II impacting or impacted then, impacting now, and it may impact in the future. So this is what I want to know in the historical one. So I want to study the impact of particular thing and I want to work on that. So now last but not least, this is the action research. So when I talk on the action research, it is the researcher and the participants, they work together because they are more into resolve something. They are more into to solve some problem. So when I say solving a problem, that means I want to get an idea that how researcher and participants are working, and I want to get an idea how this problem can be solved. So let's say I want to do some action research in healthcare. I want to do some action research in, education, where I want to understand how to improve student engagement and performance while taking the classes. So this is what I want to get an idea on some different types of qualitative research design. So I'm not able to, yeah, is slide moving for everyone?
Ma'am, it's moving.
Yeah. So next we are coming to the data collection, as this is one of the topic which I have been taken, which I have been given. So when I talk on the data collection, as already I have spoken that this is the technique and tools which I use to collect the data. But before I move into the techniques, I just want to give you a brief or overview. What should be the elements? What are the key elements of data collection we should keep in mind? So whenever I'm planning to collect any data, it should be more in organized approach. So whatever the information is gathered in a structured and consistent manner to ensure reliability so that I can trust on that. So when I talk on the data collection, it should be more in an organized manner. So it is very, very important to make it objective oriented. So my objective that I want to see that how I can engage my students. I want to see how lung cancer is leading to this, like how smoking is leading to the lung cancer. So that's my objective. So whatever objective I have fixed, that should be oriented to that objective. The choice is guided by the specific goals and the questions of the research. So it is very, very important because my objectives are coming from that research question. So most important, again, what is the type of data I want to gather? Depending on that, what should be my technique I'll be using? Whether I'm going for quantifying the data, whether I'm doing the qualitative data, whether this is open-ended, whether it will be closed-ended, what is the kind of technique I'll be following? Will it be semi-structured or structured? There are a lot many things. So I am gathering the data which is quantitative or numerical, or I'm gathering the data which is descriptive or qualitative. So coming to the fourth one, source of information. So when I talk on the source of information, it depends whether I'm collecting the data directly from my original observations, directly from my original interviews, directly from my original data collection, or I'm using some journals or some records or some published guidelines to gather the data. So what is my source of data? From where I'm going to obtain data, whether this is a primary data or secondary data. We'll be talking much on the primary data and secondary data. That's very, very important. These key elements are very important to consider when you're proceeding to collect the data, so that we have to look into. So there are 5 W's of data collection. So the W1 is what information is required, what I want to know. For an example, the information is required to understand patient satisfaction with healthcare services. So I want to know the satisfaction of the patient with the healthcare services. I should be very much clear what is required. So my data collection technique will be based on that. So I'm going to collect the data on their satisfaction levels of the patients. So why I'm collecting? Why are we collecting feedback from the customers? Because I want to solve some problem. Here comes the action research, because I want to improve the product or my service. So I am a teacher, being a professional in the nursing profession. I am more into, if I collect my data, if I get the feedback from my students, so I am more into the notion that if my students are giving me good feedback, and if the students are giving some feedback where I have to improve. So that's why I'm collecting data. I'm getting the feedback so that my students can tell how Anu has taken the presentation, so that I can improve further for the next presentations. So you can give me at the last anyhow. So coming to who are the respondents for this particular survey? So the survey means I'm gathering some data, I'm collecting the data, the patient satisfaction. So who will be my persons? Who will be the responders? It will be healthcare professionals. Will it be students who are giving the data? From where I'm getting the data? Are the patients from I'm giving the data or getting the data, sorry? Or they are my healthcare professionals on whom I'm conducting some research, that how they are working in the particular ward, or they can be patient from where I can collect the data. So who will be my samples? Where I'll be doing this, what will be my place of interview, where I'll be getting this data, whether I want to conduct the data from the field, whether I want to conduct the data from the hospital, I want to conduct the data from the clinical posting, I want to conduct the data from the classroom. So it may be clinic, hospital, it can be anything. So when I talk on when, it's more and more important. What will be the duration? I am taking the data before I'm giving the medication to the patient, or after I'm giving the medication to the patient. I'm getting the data in the morning, I'm getting the data in the first year, or I'm getting the data in the 4th year. I'm taking before and after. So this is very, very important. What is the right time? What will be taken? Why will be taken? Who will be the person from whom I'm taking the data? Where will be I collecting the data? And when it's the right time to collect the data. So these 5 W's are going to be a great help when you're planning to collect your data, and you can work accordingly. So what is the purpose? Very important. Why it is important to collect data? Informed decision making. Yes, it's a help. I have a data, so it will be easy for me to quantify. It will be easy for me to analyze. Then I can decide on. So there are students who have given a feedback to me that, ma'am, your presentation was not good. You were so fast. Your slides were not good. You were not able to explain in a comfortable language. So that's my feedback. So my feedback is, Anu is not a good teacher. So this is an informed decision making. So taking it in a positive way. And my slides are very good. Students like my way of teaching. So Anu is a good teacher to keep in the university. So that's the informed decision making I can have based on some empirical evidences. Empirical evidences means I have some quantified data on which I can rely. So coming to the relationship and patterns, to identify the trends, to identify the relations. So Anu's presentation was good because she was well prepared. So it is important, if you prepare well for the presentation, it is always you will deliver the good presentation. So Anu's slides were not clear because it was not prepared well. So that is the pattern and relationship we can see in the data collection. That is the purpose it is been served. So this is obviously, when you have the data in your hand, you can show it to anybody. See, this is the feedback for Anu. If Anu is a good teacher, you have the feedback. If Anu is not a good teacher, you have the feedback. So you need not to say to anybody that this is what I am subjective. I am objectively showing you this is the what feedback I got from the students who are joining this particular webinar. Definitely, whatever the data is there, if it is correctly structured, taken care of, it is accurate and reliable. I can trust on the data because out of 100 students have told 80 students have told Anu ma'am is not a good teacher. So that's the point I want to show to that. That is means accuracy and reliability can be more, because this is what I have as an evidence. So this is the way when you collect the data, this serves the purpose in these many means. So there are different types of data collection techniques, which is based on the design, which is based on the origin. So let's talk on the design. Already we know quantitative or qualitative. So two designs. I want to use the data for quantitative one, whether I want to use for quantitative numeric rating, or I want to use the data where I want to understand the complex phenomena. So I should be very much clear what is the purpose of collecting the data, to quantify the results or to make the phenomena or contexts. So based on the origin, it is primary and secondary. As already I have told in the previous PPT slide, that when I talk on the primary, that is the original data. I am the person as a researcher is going and taking the feedback from my students. That means that is a primary data. That is the original data which is collected first hand by the researcher. So now Anu's data, which I have collected, is being collected by Muthu sir. So Muthu sir wants to conduct a research based on what students have given the feedback of Anu's teaching. So sir is collecting the data which sir is using the data which has already been collected by me. So this is the pre-existing data that the researcher uses for their analysis. So primary one is an original data. Secondary one, when you want to interpret the results, when you want to do the analysis. So this is the result which Anu has taken last year. So I can define that students were not happy the style Anu has used. Students were not happy when Anu teach the students through the lecture method. So rather we should think on, we should teach the students through lecture method or we should teach the students through simulation. So that is the secondary data which has been used by Dr. Muthu, which has been collected by Anu, that is primary, which has been used by Dr. Muthu to analyze, that is called secondary. So we are collecting original data, that is primary source. We are using the pre-existing data, that is called secondary source. So we'll be discussing on the different techniques. So what are the sources? So when I talk on the primary source of data collection, there are a lot many. They can be questionnaire, they can be interviews, focus group discussions, field research, experiments, observations, and many more. So this is a primary source. I am collecting through the questionnaire. I am conducting the interview. I am doing the observations or some experiments. So the second one is secondary source. There is one mistake in the middle one. This is a secondary data. The secondary data which has already been published, which has already been generated. It can be some books, some journals, some database, some government guidelines, some government census, website, or whatever the reports already been published. So that is the secondary source of data collection. So let's see one by one what are the different techniques. So I'll not be taking much time. I'll be finishing my presentation in next 10 to 12 minutes. So when I talk on the survey questionnaire, this is a structured method of collecting data using a set of predefined questions. I want to collect data based on different questions. So it can be used for quantitative as well as qualitative. The techniques, it can be knowledge questionnaire, it can be online, it can be face-to-face. I can collect the data in both means. Online means I am sending some questionnaire on the Google Forms, or I am conducting interview online, I am conducting interview face-to-face. So same way, so that is interviews is like we are collecting the data involving the conversation between the researcher and the responder. So I am conducting the interview with my students. So interview method can be used for quantitative, but this is more basically we use for the qualitative one. So in the qualitative, I am conducting the interview where I want to see the response of my students. So my students' response is what? I am conducting the interview of the student sitting in this particular webinar. Then how did you feel about the webinar? How Anu has started the webinar? How she could explain you whether it was useful or it is useful for you, whether it was not. So this is the purpose I'm forcing, and it can be structured where I am fixed on some of the questions. I am going to ask these 3 questions, or it can be semi-structured based on if I have to change a little bit based on the answers, and it can be unstructured. Whatever comes out, I just ask. The focus group discussion. This is the technique where you involve a group of 6 to 12 people, that where you want to understand by the moderator. So the moderator is there. We are doing the group discussion where you want to understand the group interactions, where you want to understand the group opinion and their perspective. perspective to something. Their perspective can be different. So this is what I want to know. That can be qualitative again. So this is group discussion, means we are conducting the qualitative data, and this can be by the guided topic. It can be one topic I want to discuss. How did you feel about the simulation methodology? How did you feel about the Anu's presentation? So there can be same opinion. Ma'am, Anu's presentation was not good because she was very fast in speaking. So there can be many reasons. So then there will be group interaction. They are talking to each other and then they are coming to one opinion at the end. So coming to the observation, it is a data collection method where the researcher observes and records the behavior, events or conditions. So my observation is my first year students are very good in performing the vital skills. So they are doing the vital parameters, they are going to the clinical and they're very good. So how they are behaving, how they are approaching to the patient and how good they are washing their hands. That is the behavior I want to observe. It can be quantitative, it can be qualitative. So when I talk on the qualitative data, I am just understanding the practices and their behaviors, where I'm just doing the subjective data. How they are talking to the patient, I am writing that annotations. I'm writing as it is, how they are talking to the patient, how they are considering the concerns of the patient, how they are gelling with the team, how they are gelling with the family members. Now, techniques can be participant, non-participant. It can be both ways. So when I talk on the participant, the researcher is the part of the student knows my teacher is observing me. That is participant. And the student does not know my teacher is observing. That is non-participant. So next is the experiments. So in the experiments, it is something missing here in the slide. Just I want to clarify. The experiments is I want to gather the data where I want to see the methods where researcher wants to observe the data after doing some experiments on them. So there are the techniques where they want to conduct some researches accordingly, where they want to use the quantitative and qualitative data. So students are collecting the data after doing some experiments. So I have given them the lesson plan. Now I want to see what is the effect. So there can be multiple things. So I am giving them the lesson plan. I'm teaching through the lesson plan. Then I'm giving them the questionnaire. After questionnaire, I'm taking them the, before I'm giving them the questionnaire, I'm taking the results. That can be knowledge questionnaire. That can be any observation. So now I have taught them something new. Now are they implementing the same thing? Now I'm again collecting the data. So that can be through knowledge, that can be in the form of observations or checklists. So case studies. So in the case studies, it is in-depth analysis of single subject, group or event over time. So I want to know, there is a in-depth understanding of one subject. I want to know what is happening. So in that, I will be conducting the interview. I will be going for document analysis and I will be going for observation. So I want to observe my students, how they are able to understand this particular thing. So the qualitative data is basically used in the case studies manner. How my students are improving with the time when they are joining the nursing, how they're able to grab on the subjects when they join nursing in the first year. So I want to do the in-depth analysis. So I want to understand their perspective and I want to understand the complex issues. So I can conduct the interview with them. I can go for the document analysis. Document analysis is already what I have. I want to get from the document. I have told, let's take an example of document analysis. I have given one diary for my student to write every day. What is your new learning? What you learned today? What you learned after 10 days? What you learned after 20 days? So that is the reflective journal of the student. Student have that diary. So that diary is my document from where I can analyze. So this is the technique I can use. Or I can go and observe the student's perspective, that how students practices, that how he is gelling with the patient and how he is gelling with the classmates. So this is with the time, one person is being observed, single subject. It can be single group. It can be single subject, which can be observed for long time. So this is the way we have to do. So now coming to the secondary source of data collection techniques, it is more on, we are examining the existed documents. It can be journals, it is the text or some information. The purpose is, again, it is being used for qualitative and quantitative techniques. It can be from the report, it can be some historical documents, some diaries, some newspapers, some journals, some research review articles, some magazines, some newspapers, so many things that can be done. So now, as if we have covered, so my key takes are: selecting the right data collection technique is crucial for accurate results based on research goals, that are your objectives. your resources, data type, and audience. So it is very, very important when you collect the data, you have to choose what is the right data collection technique you are going to get the accurate results. The second, combining the both techniques, it can be primary and secondary, it gives you a deeper and comprehensive understanding of the problem. So let's say if I'm collecting the data for the methodology which Anu has used with the student in the first year, it's not only I'm relying on the data which I am collecting now. I can rely on the data which has been collected long year back. So it is very, very important to collect the primary, the original one, and if you merge that with secondary, that gives you more understanding of the problem. So the primary techniques give first-hand data, secondary provide the context, while qualitative and quantitative methods explore ideas and offer the matchable insights. So it is depending on what is the type of data collection technique you are following. Are we following both? Then it makes more sense. It can be quantitative, it can be primary or secondary, it can be qualitative, it can be primary or secondary. So there are mixed methods as well, as I already discussed. So accurate data requires planning. Your goals should be clear. You should use the proper tools which are validated and reliable, considering the ethical concerns, and you have to get it connect. So that is very, very important when you go and plan your strategies for the data collection. So effective data collection underpins research, enabling informed decisions and give you reliable results. So that's very, very important, that how you are able to get the key takes for the particular research. So this is all about my presentation. If you have any query, you can please ask. If you don't have, I have some questions. If you allow me, I can ask for the students.
Yes, ma'am. Please.
Ma'am, someone asked, can we use a different sampling technique in mixed methodology? And
Sorry, sir. Can you speak it again?
yeah. Somebody asked, can we use different sampling techniques in the mixed methodology?
So it depends. If you want to go for the mixed methods, like it is depending that what you want to connect, right? So in the mixed method, what happens, like we are collecting the data where we want to understand that this are different. So we can always, we have to, it's not we can always, we have to actually use the different methodology of sampling technique in the different mixed method study, because in that we are connecting the quantitative as well as we are collecting the qualitative. So when I talk on the, for an example, if you want me to give an example on the different technologies, different techniques of sampling, it is like if I'm collecting the mixed method research, if I'm doing the mixed method research, I am opting a method of purposive sampling, but I want to opt the snowball sampling as well. So it is the multiple techniques I can definitely. So answer is yes.
And
Thank
can
you,
we
ma'am.
use true experimental research design in mixed method? That's another question.
So mixed, first of all, I want to make it more clarify what is mixed method. Mixed method is we are doing the quantitative as well as we are doing the qualitative. So in this, both are happening. It can be quantitative followed by qualitative. It can be qualitative followed by quantitative. So that is obviously possible. You want to do the quantitative, it can be true, it can be pre, it can be quasi. But yes, you can do, it can be followed by qual. So in mixed method, it is totally possible to conduct the true experimental as well.
Thank you, ma'am. Thank you for your brief and elaborate session on research methodology and data collection, ma'am. Thank you, ma'am.
Thank you. So
Now I
shall
call
I
upon
ask some questions? Are the students ready?
Yeah, yes, ma'am. You can. If you want to
Anybody
share
would
your.
like to? Yes. Is it visible?
Yeah, yeah. Please, 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 please.
So the question is, surveys are the secondary form of data collection. So what will be the answer?
Please chat in the box.
Surveys are the secondary form of data collection. Once you know, I'm
Primary,
not able to see
yes.
the chat.
No, no, primary.
I'm getting the answers in the WhatsApp group as well.
Yes, ma'am. Yes, no, no.
All right. So shall I show the answer? So it is a primary form of data collection because it is originally collected through observations or questionnaire. You are doing some survey. So that's why you are conducting the primary source. This is the original data. So my next question is, data collected through focus group discussion, is it qualitative or quantitative? You can write.
Qualitative, ma'am. Most of them, they are adding qualitative.
So yes, this is a focus group discussion. This is the qualitative data. The answer is right. So because this is a group discussion, we are doing the understanding and opinion of the group as we already discussed. So next is secondary data collection technique. Which one is?
In most of them, they are giving a document analysis.
So the answer is document analysis. So most of answers are right. So this is all about my presentation. I get some question in the group. Is the mixed method and triangulation method are same? So they are not same. So mixed method is like they are like both are research approaches. They can be used for multiple data resources. So triangulation, what we are using multiple sources where you want to cross verify your findings. So mixed method is approach where you want to conduct the research. So mixed method, how they are same, they are same that if I am doing some quantitative research, the data is showing me that 80% of the students are happy with Anu's presentation, let's say for an example, right? So if I talk on that, am I audible now?
Yes, ma'am, please.
Yeah. So if I talk on the triangulation method, triangulation is I'm clarifying that whether this person is giving me this data, is this verifiable, is this correct, or is this not correct? So that depends. So if I talk on the mixed method, that is showing me if I'm quantifying the data that 80% of students said this is Anu's presentation is right. And if I talk on the other thing, the triangulation where I'm verifying. So if I'm doing mixed method, the quantifying is 80%. But when I do the mixed method, I'm doing the qualitative of data. Now I am taking out of 80%. Suppose 100 student has given the result that 80 students say Anu's presentation was good. So now I want to take out of 80, I will be taking 10 to 15 students for the qualitative where I want to do the mixed method. So point is that now I am questioning the students in a way that what is the reason, what they find good in Anu's presentation, that is verifying my data. So mixed method is helping me to verify, but the triangulation and mixed method is not same. So same way, that's why we say they are different, but both are different approaches. Mixed method is doing the way of conducting research and triangulation is doing the way of verifying the research. But yes, mixed method also somewhere helps you to verify the data when you ask the questions in a more deeper understanding. I hope I am able to justify the answer.
Yeah, ma'am. Yeah, I think we are running out of time also, ma'am. Already 7:15, ma'am.
Okay, no problem.
Yeah.
Okay. Now I call upon Dr. Prasanna Deshpande, sir.
Let's say thank you.
Thank you, ma'am. Thank you for answering all our questions.
Thank you.
Now I call upon Dr. Prasanna Deshpande, sir, to give feedback about the session.
Am I audible?
Yes, sir, please.
Thank you, Ms. Grover, for that informative and engagement presentation. It's evident how
Thank you,
well
sir.
structured research and contribute significantly to nursing practice. As we come to the concluding part, is that some key elements like systematic research methodology involves defining clear research objectives, choosing an appropriate study design that is both qualitative, quantitative, or mixed methods, and implementing the ethical practices to ensure the integrity of the research process. And effective data collection techniques are what we talked about. You talked about that is data collection is a cornerstones of any research study. In nursing, commonly used techniques include surveys, interviews, observations, and simulations. Choosing the right technique depends on the research questions, what we asked, and the target population, what we have, and the available resources. A heartfelt thank you, Ms. Anu Grover, for her invaluable insights and all participants for
So
their
much,
active
sir.
engagement. This session has
Thanks
been
for all
truly.
the students and all the participants for listening and asking the questions. Thank you so much.
Thank you.
Thank you, sir and ma'am.
Thank you, ma'am. Thank you, sir. Thank you, ma'am. Now we'll go for the fourth session on statistical analysis for nursing research by Dr. Amalraj Anthony, sir. Now I take this opportunity to introduce our moderator, Mr. Bharat Kalal, who has completed his BSN and MSc Nursing from RGHS Karnataka. He has more than 15 years of clinical and teaching experiences in the field of nursing. He has been worked as a nursing officer at various hospitals at Karnataka. He has attended various conferences, webinars, and in-service education programs. He has attended many trainings on NABH organized by CAHO. He has attended organ transplant coordinated program conducted by Mohan Foundation, and currently is working as ICN at Institute of Nursing Sciences, Hubli. Now, I invite Mr. Bharat Kalal to introduce our moderator for this session as well as our eminent speaker.
Thank you, ma'am. Thank you for the introduction. I take this opportunity to introduce the moderator of this session, Dr. Manjura Rajora, ma'am. Ma'am is chairperson of the research committee, NSS Karnataka. I request Dr. Manjura Rajora, ma'am,
To chair this session.
To
chair this session.
chair the session. Ma'am is Associate Professor, College of Nursing, AIMS, Delhi. Ma'am has the professional qualification of the BSc Nursing at AIMS, MSc Nursing, AIMS, and PhD Nursing, INC, New Delhi. Ma'am has the qualification, professional experience of the 15 years, more than 15 years. Ma'am has a working experience of Associate Professor at College of Nursing, AIMS, New Delhi. Ma'am is certified BLS and ACLS provider. Certified. Ma'am has a lactation certification, lactation management counselor by BPNI, and ma'am has a TOT simulation based education. Ma'am has published publications, peer reviewed journals, and members of the editorial board for the Nursing Journal, Sage Opening Nursing Journal, Journal of Comprehensive Nursing Research and Care. Ma'am's 2 ICMR concepts professional accepted. Book. Ma'am has written the book chapter Rajora Mehra and other comments. Ma'am is a professional member of the TNAI, NRSI, NSS. Ma'am has guided MSc thesis more than 15 and PCBSc and BSc Nursing research projects. And ma'am has MSc thesis evaluator. Ma'am is a evaluator for the thesis evaluator, MSc Nursing and BSc examiner, resource persons in various experiences and workshops. Ma'am has organized webinars and in-service education programs. And this is my privilege to introduce to our second eminent speaker, Dr. Amalraj Anthony, sir. Sir has completed his BSc in statistics at St. Joseph College, Trichy, India, University of Madras. Sir has completed his MSc in statistics, Loyola College, Chennai, and sir has completed his PhD in biostatistics, Christian Medical College, Vellore, and India, Vellore University of Madras. Sir has experience of 25 years plus more, and sir worked across the academia in medical field with industry experience across the Middle East, South Aramco Health Center at North America geographies. Sir has experts in providing statistical consulting services during the design, collecting primary, secondary data, analysis, and reporting the phases. Sir has a knowledge in various complex statistical techniques such as a longitudinal analysis, advances, multivariate statistical models, including logistic regressional model, Cox models, etc. Sir is highly skilled in presenting ideas and concept of the clearly statistician and non-statistician audiences. Sir has a pharmaceutical experience and GMP background. Sir has excellent acknowledgement in SAS, JMP. Sir has a co-authored. Sir is co-authored several research papers in international and national scientific journals. I request, I request Dr. Amalraj Antony sir to take over. Sir, it's over to you, sir. Thank you.
Thank you and welcome, sir. Amalraj, sir.
Yeah. Thank you, sir. Thank you for your introduction. Good introduction. Okay, because of time concern, I don't want to waste my time here because already late. I should start from 7 itself. Because my section is only 1 hour, so I have to explain the whole statistical methods used in nursing research. So I'll share my screen now, and maybe you can.
Please share your screen.
Yeah. Hope you can see my screen, right?
Yes, sir.
Okay.
It's visible, sir.
Yes. 1 minute. I can hide my camera. I hope it's clear. My voice also clear, right?
It's clear, sir. It's clear.
Okay. Okay. Now I'll start. So I'm going to talk about this section, a statistical analysis for nursing research. I'm Dr. Amalraj, and already they introduced. Presently, I'm in Canada working in the pharmaceutical companies as a scientific
Put it
leader.
in presentation mode, sir.
What? Yeah. So I'm in North America, Canada, working at Apotex pharmaceutical company, work as a scientific leader supporting all statistical analysis and statistical support in the research and development department. I don't know why. Okay. First, I want to talk about like what is the definition of statistics and in the biostatistics. Already in the previous classes, I heard that you talk about that. Already talk about the data and what type of data and what are the designs, study design and all. Already in the previous classes, you all know that. Now, sorry. Now that data are in the study design, how we can use the statistical methods based on the data and based on the study design. Okay, so we already know about the data. The data means the informations or facts and figures, okay, from various fields. Maybe it is the health field, or maybe it's the vital or hospital or community, or maybe industries, whatever. The facts and figures are systematically, facts and figures are the data or the information, okay. That data are systematically collect. There are many methods of collection. Already in the previous sections you already know that. So the using the proper method of the data collection, using the proper sampling samples, you know how to select a sample in the different type of sampling technique. Use the proper sampling techniques from through the sample. You have to collect the data, a proper appropriate method, data collection method. Once we collect the data, because the data is collected from the different individual, from the different parameters also, not only one people from the one variable. It is like comes under case study, but this we are doing the research is with a sample. The sample should be adequate, okay. The sample should be calculated using the sample size formula through statistical support or statistician support. Even the sample also we cannot determine according to our wish. So there is a statistical formula to select the sample size for the particular research using the previous studies results or like that, okay. Now, so once we collected the data from the different variables and from the different people, or the sum of the or sample size, some numbers, maybe it's 100, or maybe it's 1,000, or maybe it's 30. But so like that, so large sample always is enough to prove your hypothesis also. So another way, okay. So once we collected the information, you have makes the some presentation, or we can call as a like arrange the data first. You have to arrange the data. Nowadays, the Excel sheet or Excel software or in the SPSS is there to arrange the data through row and column wise. Suppose you open the Excel sheet, you will get in the row wise like A, B, C, D like that. In the column 1, 2, 3. So A, B, C, D, first row, you have to mention your variable. What are the variable? Maybe sample size first row in the first column, and second row, maybe you can type of group, maybe you have an experimental group and control group. You should not, for the analysis, you should not enter separate sheet for study group and control group. All should be comes in the only one sheet in the Excel sheet or SPSS, only one data sheets, not for the different data sheets. For like I had the experience, because students used to enter in the data sheet like a pre-test one sheet, post-test one sheet for the experimental group and control group separate sheet. No, you have to enter all the data in the one sheet for the further statistical analysis. It is the very, you should do like that. Then otherwise you cannot do the analysis. Maybe if you want to do your analysis your own, so you have to do in the single sheet, whether it's a SPSS sheet or whether it's a Excel sheet. You have to enter in the first row, in the first row, you have to enter all the variable name, like sample number, group, what type of study group, and then what are the demographic variable, maybe age, gender, occupation, area of the study, like that. Then you have to enter the continuously in the row the variable names. Maybe you are assessing the knowledge, attitude, and practice. You have to given that continuously in the row wise. You have to enter it. Okay, like that you have to enter the data. Suppose you have a pre-test, post-test. First, you have to enter the pre-test in the first row, in the row. Then continuously, you can keep it the post-test also, not separate sheet. Same thing, the column wise, you are going to enter one to, suppose you have a 30 sample for experimental. First, in the 30 column, you have to enter all their information in the first 30 column. And next 30 column, continuously, you can use the control. Like that, not separate sheet. On don't go with the row wise, it comes with a column wise. First 30 is the experimental and next 30 is the control. So you have to create a one separate column like study group, study, what are the type of study. So that you have to put the experimental for first 30 and next 30 for the control. Then you can follow the same row. You can enter the second row, enter their first sample, all their information. Then second sample. Like that, you have to enter the data or arrange the data. In the statistical step, next arrange the data. Next, arrange the data. So you have to do the basic, you summarize the basic statistical method like called, I'm going to explain. It's called descriptive statistics. Like suppose you want to find out some percentage or rate or maybe average, that you have to prepare some presentation format. The presentation format, there are two types, which is tabulation and graphical representation. Okay, after the presentation, so you have to use the inferential statistical method to compare or to correlate or to associate based on that to prove your hypothesis. You are going to test your hypothesis whether you are going to true or hypothesis false, or you are accepting or rejecting your hypothesis. That's through statistical inferential method you have to prove. After the your analysing, so you have to write the interpretation of your results. So that is the definitions or principles of statistics. What's the meaning of biostatistics? These facts and figures are, I already told, the information or data. The data coming from the particularly biological science, the field of biological science, that is in especially in the hospital based and the community based data. Okay, that is used in the method collecting all the hospital statistics or community health statistics, arranged and presenting, then analyzing statistical methods, then the interpreting of the results is called the biostatistics. Okay, next is what are the main statistical methods are using in the nursing research. That broadly there are two areas. One is a clinical medicine, or we can call as a hospital medicine, hospital based, or next one is the community medicine. Okay, so clinical medicine, especially these 6 areas, to in the documentation of the medical history of disease, their course of progression and variability among patients. Then in clinical epidemiological studies on etiology of health events, determine of relative risk and odds ratio. So what are the factors influencing to get the particular disease? So that's we are using the statistical method. So this is not coming as it is. It is the disease is the one of the dependent factors. So that it's developed the disease. There are many independent factors are influencing to get the disease. So that's we are finding which factors are more chances or more risk or odds of the ratios getting these particular disease. That's we are using the statistical method in the planning and conduct of therapeutic and prophylactic clinical trials to determine the superiority of specific therapies. For example, just we talk about the true experimental study. So we are giving the intervention program. We want to prove that our intervention program is effective. Maybe it is a medicine, or maybe it is a therapy, or maybe it's a teaching program. Whatever we are giving the intervention program. If we want to evaluate the intervention program, it is effective or not. So we need the statistical methods to prove that. And in calculating of diagnosis efficacy and likelihood ratios in prognostic studies, in providing methods for the definition of normal, indicating at what point the measures of some bodily characters becomes abnormal and pathological. Okay. And then in supplying the measurements of accuracy of various laboratory and clinical procedures that commonly used in medicine practice. Same thing, the preventive medicine or community medicine. What are the role of statistics? There are 5 points I mentioned here. In assessing the states of health community, in listing the met and unmet needs, and in providing a community diagnosis, and in prediction. Okay, to identify the basic socioeconomic, political, demographic factors underlying the state of health, and to suggest possible solutions for control, elimination, and eradication of communicable and non-communicable diseases, to assist in health program evaluation, health system research in determining the success or failure of specific health interventions, in planning and implementing community health and development program and their monitoring and surveillance, to promote health legislation and health equities, creating administrative standards for health activities, and promoting social justice. So these all are the main points to the role of statistics in the preventive medicine. Okay, I think this is the general, but this one already even the last class talk about like qualitative and quantitative. The data types or the variable, there are broadly we can classify, there are 2 types, which one is the quantitative and qualitative. So the quantitative is always measured with the numerically, not any name or letter or symbols or colors, nothing. So the quantitative measures are purely numerical. Any variables or any data, you have a numerical value. That numerical means not coding room numerical. So the variable itself numerical. For example, sometimes in the gender maybe we are giving the coding like 1 for male, 2 for female. It is not a quantitative measure. It is a purely qualitative. We are making the coding to do the analysis. But actually, this is not a gender or like occupational status or area of study or area of living. These and all like qualitative, not as a quantitative. Quantitative are measurable value like height, weight, hemoglobin level, BMI. All these all are like all the blood pressure, and that even knowledge assessing from the different questionnaire. All this is called the quantitative measure. Numerically we are measuring. Okay, under quantitative we have a 3 types, that is a discrete and continuous. Any variable have the value like a full digit number. For example, today a number of participants in this section, I can say like 35 or 100 like that. I cannot say like 30.5, 30.2. So the full number, full digit is called the discrete or discontinuous variable. Okay, any variable, any numerical variable or data having with a decimal like height, weight, body mass index, these all are with the HP value, all with the decimals. So this is comes under continuous variable. These all are the example I given for the discrete and continuous variable. Same thing in the qualitative, purely is the categorical, not numerical. What are the variables or what are the data have a categorical value is called the qualitative. That's broadly we can classify. There are three types, which is dichotomous. Any variable have only two response, yes or no, true or false, or men and women, or boys and girls, like only two category, which is called the dichotomous or binary qualitative data. Any data is more than two category, like maybe blood group or marital status or educational status, occupational status, these all are more than two, you have a categorical, then it is called the nominal variable. Any variable have a ordering, like a scale, or any scale, like the ordering scale, like satisfaction score, like we have satisfaction scale, like we have a highly satisfied, satisfied, moderately satisfied, not satisfied, not at all satisfied. This is like grading, or you are a very good, good, moderate, average, or moderate, poor, very poor. This is like ordering. This we can give the scoring also. For example, the rating scale, sometimes we have a very high, high, moderate, poor, very poor. We are going to give the score also, like 0, 1, 2, 3, 4, 5, like that. So this called the ordinal scale. Sometimes the ordinal scale convert as a quantitative measure when we give the score for the the ordering of the category or response. Okay, these all are the types of variable and type of data. Without knowing that, this, without familiar of this data type, you cannot choose even studies or variables. You cannot choose the statistical method. First, you have to familiar with the types of variable or types of data, which are quantitative and qualitative. Based on the qualitative and quantitative data, we are going to use the statistical method. So the quantitative measure, we are going to different type of statistical method, and qualitative, we are going to use the different type of statistical methods. Okay. So again, we can say as the variable like independent, dependent, both, that is not type of variable. It is a variable, whether quantitative and qualitative, both, we have a independent, dependent. That is means I already explained that when we do suppose this is not coming as it is. It is influenced by some other variables. Okay. So that type of variable is called the cause and effect. Cause are the independent variable and effect are the dependent variable. Okay. The intentionally manipulated independent variable, intentionally left alone for the dependent variable. Always for the most of the statistical methods, the dependent variable should be only one. The independent variable may be one or more, because not only one variable influencing to get the dependent variable. There are sometimes many variable influencing to get the dependent variable. So it is independent variable is a controlled one, but dependent variable is the measured. Okay. And vary at known rate in independent, vary at unknown rate is the dependent. Okay. Independent is a cause and dependent is the effect. These all are the, this is not type of variable or type of data. In the type of data, when do for the any independent, dependent statistical method, that time which one is the independent variables and which one is the dependent variable, we have to identify which are the cause and effect of the variable. We have to identify from the study variable. Okay. Now I told the next is the, once we do the basic summarizing the data, we have to make the presentation. The presentation, there are two format, which on the presentation, once data has been collected, it has to be classified and organized in such a way that becomes easily readable and interpretable, that is converted to information. Okay. Before the calculation of descriptive statistics, it is sometimes a good idea to present data as a table, charts, diagrams, or graphs. Okay. Most people find pictures much more helpful than the numbers, in the sense that in their opinion, they present data more meaningfully. Okay. There are two types. One is the tabulation, another one is the graphical representation. Okay. Now Okay. Now, the use of presentation, easy and better understanding of the subject, and provide first-hand information about data, helpful in future analysis, easy for making comparison, very attractive. Okay. The rules we have to follow, you all knows that we need the table number and table title and a row and a column explanation, and body should be filled without don't blank, keep it blank anything inside the body, and you have to any special character you mentioned in the table, you have to explain in the footnote. Okay, these all are the main rules. So this is the dummy table, what you are going to follow that. So already explained that. And the types of table, there are symbol or one way, two way, three way, and multi way. So only one variable used in the one single table, it is called the symbol or one way table. So we are using the more than two variable, so we can call as a multi-way table. Okay, in the same table. Okay, now graph, there are three graph. The limitation is maximum two variables only used in the graph, but in the tables, whatever many variable, maybe 5 or 4, I told you multi-way table. So you can use the single table itself, you can use more, even 10 tables, 10 variable also. But in the maximum, the graph, two only, y-axis and x-axis, you can use that only two variable. And graphs are not accurate at a tabular data. Only tabular data is more accurate to use the further statistical inferential analysis. Okay. Now the types of graphs, there are three types: line graph, pie chart, and bar diagram. Because of lack of time, I'm not going to explain very clearly, but you must know when we are using the line graph, when you are using the pie chart, when you are using the bar graph. Okay. Now line graph, when you want to show the trend, for example, the x-axis should be always use the time period, time point. We want to use the time point in the x-axis. You want to show the trend in the different time points, different month or different days or different year. You want to show the rate or ratio or percentage. So that is called the we have to use the line graph. So you must, the x-axis should be time duration. Okay. Now the pie chart mainly used for the only single variable. For example, in the different age group, you want to show that how many people with the percentage. Pie chart is nothing but percentile chart. When you are using the single variable pie chart, you can use only one variable at only one pie chart, but different category. So the category is too many, like more than 8 or 10 category, better you go for the bar, single bar diagram. But in the pie chart, only the percentage available for the single variable, totally 100%, then you can make the pie chart for the single variable. Okay. And then bar diagram, there are many types of bar diagram, like we can call as a symbol bar diagram, just like that. Only one variable with a different category you want to show in the bar diagram. We can use pi instead of this, but pi, it's too many category, it will be more confused or more clumsy. So for that, if it is 5 and above category in the single variable, better you can go for the symbol bar diagram. Suppose you want to comparison, then you have to use the multiple bar diagram. You have a two variable, you want to compare, like for example here, the different years of the nursing class with the boys and girls, you want to compare, you can use this comparison, multiple comparison bar diagram. Suppose you want to use the deviation when you have a negative value and positive value in the same variable, then you have to use the deviation bar diagram, because the center should be the 0, above should be positive, below of the 0, the center should be is the negative value, you can present it. Next is the component bar chart. Suppose you have too many bars with too many category, it is more clumsy for doing the multiple bar diagram. You can go with that, like that. You have to divide the single bar itself, divided the category in the different groups. So this is called the component bar diagram. This is the example of same whatever the boys and girls with the different classes, instead of separate bar, we can component, we can make the single bar itself, we can divide the numbers. Okay. Next is the percentile bar diagram, which is each group have a full 100%, not like this. It's each group is a different numbers, different total. But here all the categories that 100 in each one, then it is called the percentile bar diagram. Okay, these are the charts or diagrammatic presentation and table presentation. Okay, now I'll go to the main, this one type of statistics. The statistics described as a descriptive statistics and inferential statistics. Descriptive statistics, we are not comparing, we are not going to correlate, just to summarize the data using a basic statistical method, like it's called univariate statistical analysis. Whenever we used only one variable for the only one sample means group of sample, like only the study group of the sample or only the control group of the sample, only one group with a single variable, we want to do a summarizing that variable is called the descriptive statistics. And that after the summarizing the data, so we want to do the any comparison, or we want to generalize to the general population using our sampling results, then we have to go for the inferential statistics. The inferential statistics, we are going to use the two or more variable or two or more groups comparison, or to correlation, or to associate, or to estimate to the general population using the sample value. We are using the inferential statistics. It's called bivariate or multivariate statistical methods. Okay, because you are using the more than one variable or more than one group in the statistical method. Now, descriptive statistics, like just we are describing or that basic feature about the data, to do the basic summarizing the data is called the descriptive statistics. There are two types of descriptive statistics for the quantitative measure, numerical value, which are measures of central tendency and measures of dispersion. Measures of central tendency is that among the given, because we are not having the only single value, we have a bulk of data in the single variable itself. Many samples we are collected, many individual we are collected. Okay, in that we want to summarize or find out the centered position among all the given observation. We are using the measures of central tendency. The measures of dispersion, to find out the variation, or that we can call as the how much is the differentiate from one to another data, another individual value. We want to measure with a single value of the dispersion, of the variation, of the difference. It's called measures of dispersion. Okay, there are many methods we are using the measures of central tendency to find out the locate the centered position. Same thing, we are using the many statistical method to find out the dispersion or differences. Okay, now these two for only we can use a quantitative measure, numerical value. We cannot use for the categorical or any like letter format. Okay, for that qualitative data, so we can use the descriptive statistics, just numbers or the percentages or rate or ratio. These all are the descriptive statistics for the qualitative data. Okay, now measures of central tendency, as I told you, that to find out the central position among the given observation is called the measures of central tendency. There are three types: arithmetic mean, we can call as average, or median, and mode. There are many measures of central tendency, but in our nursing research, widely we are using mean, median, mode. Among these three, mean is the more appropriate measures of central tendency when compared with the median and mode. But in the mean only we are going to use for further statistical inferential statistics. And maybe we are going to use even to calculate some dispersion, like standard deviation or variation, or we want to find out the coefficient of variation. We are using the only mean among these three measures of central tendency. So mean is the more important. Okay, now, so don't worry about that. There are grouped, ungrouped. You can use even the large data, because we're going to use the computer to get all this information. But what are the importance? Don't worry about the calculation part. Now so many softwares are available, so to get all mean, median, mode. But when we have to use it, that is important. Arithmetic mean always we are going to use for the further statistical methods. But when is arithmetic mean is not more valuable, when that sometimes the extreme data or outliers are available in the data. In that situation, median is the best measure than the mean. This is the only disadvantages in the mean, when the data having the extreme values or outliers in from that. Suppose we have a spec limits, so the values are beyond the spec limits, like control limits. In that situation, suppose we have to do the mean, we have to omit outliers in that, or we have to omit the extreme value and put it the normal data. Or we can properly, you want to show that including in that extreme values, then you want to show the summarize the data, use the median. But you cannot use the further statistical applications or inferential statistics. Mode is when we are using the mode in the central tendency, any one value. For example, in the class, in the maybe in the first year or second year, third year, the age of the students, most of them maybe first year around 19 or 18 to 19, right? Where very few were maybe below 18 or above 19, like that. So in that situation, any one of the value most frequently occur among the given observation, that time that value is called the mode. Okay, but many books are wrongly written. There are bi-mode, triple mode, or four mode, like that. No, see, measures of central tendency is the only one only one value based on the given all other observation. Even mean or median or mode, you should be only one mean, one median, one mode only. No two mode, two, three mode and all. So many books, non-statistician, even nursing books, I review that there are triple mode, tri mode. No, only one mode. Suppose all the values are only one time occur in the observation, or more than one value same times occur. In that situation, you have to use the formula mode equal to 3 median minus 2 mean. You know how to calculate the mean, you know how to calculate the median. Then mode is all the values are, because what is the mode? Most frequently occur, any one of the value most frequently occur, that is a mode. Now here all the values are only one time occur, or more than one values are same times occur, then mode should be calculated 3 multiplied by median minus 2 multiplied by mean. That time you will get the mode. Not triple mode. Sometimes you will get the 5 or 6 values are same times occur, then you cannot say 6 mode. No, you should be calculate only one mode. If it is that situation, use the formula 3 median minus 2 mean. Clear? Now frequency distributions, the data is large, like more than like 30 50 data. To do the manual calculation, we make the frequency distribution, and that frequency distribution like this. So we have to make the class intervals and put the tally marks from the individual value, get the frequency. This is called frequency distribution. Okay, through that we can draw the like histogram and frequency polygon. The frequency polygon is there like a line graph. That line graph shows is there like maybe scatter, or it's a bell-shaped curve, or maybe skewed in the many this one. So when the skewed graph is called the skewed graph data, and the data is bell-shaped, it's a normal distribution. Okay, so these all are the I don't want to explain all these, because this how to calculate it. Maybe you will get this notes, maybe you can use it. And methods of dispersion is the find out the how much the dispersion and variation. So there also there are many types, that are range, interquartile range, mean deviation, variance, standard deviation, and coefficient of variation. Okay, this is the main how that methods of central tendency. Standard deviation is the very important. Same here, mean is very important. Same thing here, the methods of dispersion. Standard deviation is one of the most reliable methods of dispersion. So these standard deviation widely we are using in the further statistical inferential method also. All this is the standard, the dispersion, the variation. It's the best measure is the standard deviation. So these all are just ranges which one is the lowest and the highest, and the interquartile range is quarter, the fourth quarter, the interquarter, second and third quarter, the lowest value to highest value, we will get the interquartile range. Mean deviation, nothing, just formula, we are not using at all. Variance is one of the standard deviation. When we take the square root of the variance is the standard deviation. So standard deviation, variance is nothing but the square root of square of the standard deviation. The coefficient of variation, these dispersion we want to express with the percentage format, the coefficient of variation will come, which is like standard deviation divided by mean multiplied by 100, we will get the coefficient of variation. So I have all the calculation part here. Now we'll go to the probability. Probability again important. Before going to the probability, you need the terminology about population and sample. So the studies we are not going to do with the population. Very rarely when the population itself very small, then we can use the entire population, or only census method and all, we are going to use the population studies. But in our research, always you are doing with the sample. So population is the entire group or universe. Okay, suppose in the community we are going to see the population means all individual or your specific group of the population, only the mother's reproductive age group, or only teenagers, or only adolescents. So who all are available teenagers, your population, when your specific population is teenagers, like that. Okay, but in the sample should be there. Yeah, we have to select the proper sample. It should be adequacy. It should be represents from the population. A good population with a adequate sample, which is called adequate number, which is called the sample. We have to use the proper way, not according to our convenience. We have to use the proper statistical technique. You have to select the sample. Now, what's the parametric and statistics? The parametric, always we talk about, or any information or any statistical results based on the population is called the parameter. Any statistical results we are doing with the sample value, whatever we are getting the statistical results is called the statistics. Okay. Now, I told how we are going to select the sample from the population. We are using the probability. Okay, we are going to give the equal chance of all the individual to select a small group from the entire population. That we are using the probability. The probability is the a number of times that outcome occur divided by based on the total number of trials. Okay, so this is like a probable. The word is called, a meaning is very likely to be happen. It is a happening accidentally, or what are the happening like chance, by chance. Probability is by chance, measuring by chance or getting by chance is the probability. The probability scales are between 0 to 1. 0 is absolutely there is a no chance. 1 is 100% chance. So the probability to convert as a percentage, you have to multiply it by 100. Suppose you want to have a percentage format, then you want to convert as a probability, you have to divide it by 100. So these are the sceneries here. For example, you can see in the article, statistically significant at p less than 0.05. 0.05 is the probability. You want to represent that error is the percentage, then it's a 5%. 0.05 multiplied by 100, which is 0.5%. But in the probability, always we mention like p less than 0.05 level of significant. That means we are proved, so total 100%, right? 95% our results proved there is a relation, or there is a correlation, or there is a difference between experimental and control. Only in the study we are allowing 5% of the error. So we can allow out of 20% of the value, 1% we can allow the error. So totally 5% we can allow the error in the study statistically. It is allowed. Okay, that is the meaning of p less than 0.05. P less than 0.01 means 1% our study we allow the error. We improve our studies up to 99%. We proved our results is true. Only we are allowing the study 1%, which is represents in the probability p less than 0.05 like that. Okay. Sorry, p less than 0.01. Suppose p less than 0.001 is the 99.9%. We are allowed only 0.1% error in the study. Next is the probability distribution. I don't want to explain more. This distribution already statistician use this distribution for the formula using the mathematical models. They prepare the tabulated format based on the probability level like 0.05, 0.01, 0.01 based on the number of sample, which is called degrees of freedom. Whatever sample we have to subtract from each sample one value. Then based on the degrees of freedom, the number, the table value show based on the different statistical distributions like normal distribution. There are different families. So in that there are Z distribution, T distribution, F distribution, chi-square distribution. There are many tables are available in all the statistical books based on the theoretical probability distributions. Okay, that is you have to see with the 0.05, 0.01, 0.001 when the small sample you are studied. But it's the large sample, the standard values are there. I will show in the next slides. Now, through that, how to know the normal distribution. I showed the frequency distribution. When we draw the line graph, the graphs are bell shaped, then it is called the normal distribution. We can call as a symmetric distribution. The characteristics of the normal in the normal distribution, it is a bell shaped. First character. Okay. Second character, the center of the bell, that center of the value should be coincide with the mean, median, mode, all the measures of central tendency. The mean, mu is equal to population mean. So the centered position, that is the mean. Okay. Then the standard deviation, nearly 95. See here, 34.13, 34.1. Totally 95% of, sorry, 68% of observation fall within one standard deviation, either side of the mean. If it the given data is the normally distributed. Okay, that I explain how we can test the normality. Even this way also you can test. Once we do the data is the curve, it is the bell-shaped curve. When do that normality frequency polygon or frequency histogram, so that's a bell curve, the curve is a bell shape, then it is a normal distribution. That's one of the way to find out the normal distribution. In the computer there are statistical method also available. Shapro will test. I have a notes, I'll explain on that also. Now, what are the relations with the normal distribution with the mean and standard deviation? Now, I told you 68%. I have it is the 68% of the observation fall within one standard deviation, either side of the mean. Mean is the center position. Next, 95% of the observation fall within either side of two standard deviation, either side of the mean. Next, 99.7% fall within either side of 3%, standard deviation, either side of the mean. So these all are the characteristics of the normal distribution. Bell shaped, mean, medians are coincide in the center position. Entire, this one is the one probability, 100%. The parameters. Then I told you the standard deviation, how to play in the normal distribution role. Okay. Now is I told you the number of sample individual values more than 30 your sample, then you need not to go for that table value. It is the standard value. If it is 95% confidence, you prove, we want to prove with a 5% error, which is 0.05 level, the standard table value is 1.96. You need not to refer any table value from the books. So you want to prove with a 99, suppose you prove 95, but it's still the proof is more. So you want to prove more with that, then you can go with the next level is the 99%, which is the table value is 2.58. Then the last level is 99.9, which is 3.29. Nowadays in the computer, the probability value, it is compare and it will give what percentage, 0.05, 0.01 or 0.001. The p value itself, it will be given in the output. So you will get 0.000 also. That means it comes with the third level, 0.00. It is a 99.9, which means 100% prove there is a statistical effect. Okay. If it is the less than n equal to less than 30, then you have to find out the degrees of freedom, which is whatever sample is available. Suppose that is only 20 sample, subtract one individual value from the overall sample. So 19, then go to the table, whatever refer the table T distribution. You want to compare T distribution. You want to compare more than two group, you have to go for the F distributions. Okay, you want to find out the association between the qualitative data, then chi-square test, you have to prove the you have to show the go to the chi-square value. So like that, you have to refer the table values. Okay. Now we'll go to the inferential.
Sir, one submission, sir.
Yeah.
Sir, we are running out of time, sir. Is that possible?
So how
conclusion?
now we have to close it immediately, or
No, just take some more time. So you can come to the conclusion, sir. Already we have told 8 p.m., sir. Already it is 8 p.m. now, sir. Actually.
Yeah, I took that only like 8:25 only.
Yeah.
Okay.
7:25.
So
7:25.
10 minutes, okay?
Yeah. Please.
10 minutes, okay?
Please.
Is it okay? 10 minutes, sir?
Yes, please, sir.
Yes, sir. Yes, sir.
Yeah, I'm going to broadly summarize this. Okay. So the inferential statistics, broadly, the inferential statistics, I told you that we want to like prove our hypothesis, or we want to estimate to the population value using the sample value, then we have to go for the inferential statistics. Inferential statistics, we are there are two types that are the like estimation and testing of hypothesis. Okay, mainly we are using the testing of hypothesis with a more methodology. Before that, we want to know about the type 1 error, type 2 error. The errors are, there are many types in the research. There are sampling error and type 1 error, type 2 error. The type 1 error, type 2 error, when it is occurring, when you do the testing our hypothesis. Actual situation, the null hypothesis true. Null hypothesis always there is a no significant difference. Okay. The null hypothesis, the actual situation is true, but we reject our null hypothesis. That is the very serious error, is called type 1 error. We can call as a alpha error. But the null hypothesis itself, actual situation is false, already false. But we accept that it is called the type 2 error, not is the very serious error. We can call as a beta error. I told you that 5% error, 1% error, that error is called the alpha error. Okay. Now, confidence limits also already explained that there are three levels: 0.05, 0.01, 0.001 level. We are using this. The confidence limit based on the three level, using the mean plus or minus alpha error by 5% or 1% or 0.1% with the standard error. Standard error, we are calculating this is the formula: standard deviation divided by root of the sample size. Okay, this is the standard error we are using. Is now we have to go to the testing our hypothesis. The hypothesis, there are many problems: comparison of sample mean with the population mean, or independent t-test or student t-test to compare the two means, or two proportion or percentages. That is the another t-test, two sample test, and then correlation, we can call as a Pearson correlation, or that to compare the two to correlate the two quantitative measure. And the paired t-test, we are using that only one group of the sample, but we are measured twice in the same data or same variable, pre-test and post-test, or before the intervention and after the intervention. We want to evaluate our effectiveness of our intervention program. Is a nursing research is a very important test for the intervention program or a true experimental study to prove our intervention is more effective. That we are using the paired t-test. Okay, the chi-square test, we are using the qualitative data of the two two variables, like both are like a test and whether disease affected or not affected. Test is positive or negative, whether the disease is affected or unaffected. What factors are influencing? Mainly that we are using the qualitative data, we are using the chi-square test. If it is qualitative data, qualitative data, we are using the chi-square test. If it is a quantitative data to find out the association or relationship, we are using the correlation coefficient. Now we want to use the comparison of more than two group. We are using the analysis of variance. These are the main types of problems in the test of significance. This widely we are using this problem. You must know, actually I want to explain more because of the lack of time. So I'm explain again. The mainly we are using the second one, comparison of two sample mean. Here the condition should be two group, like we'll take that like experimental and control group. We want to compare whether statistically significant of their knowledge. Okay, then we have to use the independent t-test. Only two group, in experimental group and control group. We want to compare whether the mean of this value. Here you have to use the two group with the mean of any quantitative measure. Only one quantitative measure like knowledge or attitude or practice or stress or coping, anyone, or any other quantitative measure. You want to compare the two group, then you have to use the independent t-test or student t-test. Now you have a more than two group, like you have a experimental study 1 and experimental study 2 and that control group. Suppose you are giving that one exercise with the treatment. One group only exercise, one group nothing, only control, maybe medicine. Now you want to compare three groups, then the mean of their knowledge or their stress or their coping of the quantitative measure, then we have to use for the analysis of variance. Okay, now you want to compare the study variable like obese of men and women, obese status, maybe obese, not obese. Okay, this categorical, obese and non-obese, and then men and women both are is the categorical. Now there is a each one minimum you have to need the more than one category. Like for example, maybe in the BMI you are divided like underweight, normal, overweight and obese. Then here men and women. So you have a more than one category each group. Now you want to associate whether who is more obese, men and women. You want to find out the influencing of association between the two qualitative data, then you have to use for the chi-square test. But now you want to associate the two quantitative measures like knowledge and attitude, or knowledge with the number of experience. The both are quantitative. You want to find out the relationship or association between the two quantitative measure. You are going to use the Pearson correlation coefficient. Okay, these all are parametric tests. So we can divide all the statistical method two way. One is the parametric, another one is the non-parametric. These all are the parametric statistical methods. Okay, the same all these we can use for the small sample. When we can call as a non-parametric, the data is not normally distributed. I showed the bell-shaped, not bell-shaped curve. It is not coincide with the mean median, or you can test with a Shapiro will test prove the probability value is less than 0.05, then it is not normal. Then you have to go, you cannot use this parametric statistical method. You have to use the non-parametric statistical method that is available for all these methods. Like independent t-test, you have to use the Mann-Whitney test. Okay, if it is you want to do the chi-square test, you can go for Fisher's exact test. If you want to do the ANOVA, if small sample, you can go to the Kruskal Valley test. The paired t-test, you can use the McNamara test. Like that, there is a non-parametric test are available for all these statistical methods. Now, all these statistical problems, the methods, you have to follow the same step when you do the you summarize that. First, you have to finding the what type of problem you are going to see. You know, so many problems. Which type of problem you have to identify. Then, based on your question, your aim, your objective, what question to be, you are going to answer it. Next is stating the null hypothesis. Always in the statistics, you have to make the null hypothesis. There is no statistical significant difference. Okay. Now you have to use the statistical methods or using the computer. You'll get the calculated and the table value. Finally, you'll get the the probability value. So that we suppose you are manually, so calculated value is greater than the table value, then we reject our null hypothesis, and the calculated value less than the table value, then we accept our null hypothesis. But in the output, you will get the p value. The p value is more than 0.05, then there is no significant. The p value is less than 0.05, then there is a statistical significant. Then you can make the inference whether which one is the highest, which one is statistical low, like that you have to explain. So these are the correlation. I already explained when you are using the correlation. The correlation value will get the R. It is, you have to define the correlation is negative also and positive also. The negatively correlated, one value is increase, another value should be decrease. Okay. So you will get the R values 1, positive or negative, is a perfect positive or negative correlation. Values are getting more than 0.7, it is called the highly or strong correlation. The values are getting 0.4 to 0.6 is the moderate correlation. Below 0.3 is the weak correlation. 0 is the no correlation. These all are the, we are describing the correlation. The correlation, we need not to show one is the independent, one is the dependent. Both are maybe independent, both are dependent, or one is the independent and another is the dependent. We want to identify the relationship, we have to use the correlation. But when we are using the regression, y equal to a plus bx, this is the line we are measuring. In that situation, y should be dependent, x should be independent variable. For example, gestation age with the crown hair length of the baby. So here, crown hair length of the baby is the dependent, gestation age is the independent. So y equal to independent and x is equal to dependent. Like that, we have to use the regression analysis. Okay. So I think this is, I can generalize to that. So I have just only 2 minutes. I can explain this diagram, the hypothetical analysis. So this Shapro will W test to prove that whether the data is normally distributed or not normally distributed. You can go to the software, SPSS software. You can get this Shapro will test methods. So you can test your data, whether statistical significant or not. This we can test only the normality, only the quantitative measure, not for the qualitative measure. So the parametric, most of them were the quantitative measure. Okay. Now, these all are the main thing. I can explain that. So that is whether your group is single group or you are going to comparing 2 or more than 2 group, and you are having the pre-test, post-test, or pre-test 1, post-test 2, post-test 3, like that. And that is your study design. And what are the data types, whether qualitative and quantitative, whether the normally distributed or not normally distributed. So based on that, if it is normally distributed, you have to use for the parametric. If it is if it is not normal, then you have to go for the non-parametric method. Okay. Now, this is the flow chart. If the data is normally distributed, then you have to go to like this. Okay. Hypothesis test. If it is one group, you have to go for a symbol t test. Okay. If it is 2 group, you have to go for the paired t test. Single group, but 2 measures you are doing comparison. It is called the paired t-test. Only 2 group you want to compare, independent t-test. Before that, even you can use the variance test, whether the standard deviations are different or not. But you have to use the independent t-test to compare the 2 means. More than 2 groups, you have to use the ANOVA. Okay. These all are the your mainly parametric test. If it is non-parametric test, if it is the only one group, I already explained. I will share my notes also. If it is only one group, then we have to use the Wilcoxon sign rank test or Mann-Whitney test. Okay. If it is, the sign rank test. Here, the paired t-test, instead of pair group, you have to, instead of paired t-test, you have to use the perform Wilcoxon sign rank test. Okay. Next is 2 groups comparison. You are using the Mann-Whitney. Okay. Then the more than 2 group, you use the Kruskal-Wallis test instead of ANOVA. This already explained. So, so these are the main statistical method in the inferential statistics are available. Okay, because of lack of the time, so I will stop my presentation. Now, any question, please, you can ask me in this section. If any question, please ask me. Yeah. Sorry, this statistics is the wide uh, explanation. So because it's a very short period, I can explain only that. Maximum I explain that. Yeah.
Yes, sir. Yes, sir. We understood, sir. It's a very vast subject, and our participants are also happy and keep on telling, appreciation in the WhatsApp. Somebody asked what point and interval, the estimation. Some question there's interval estimation.
Yeah, interval estimation. That's I have already in the slide. Because when the estimation, one of the statistical inference, we used to have two types of estimation: point estimation and interval estimation. Point estimation, we are not going to do any statistical parameter to the population. Just whatever the data, suppose mean, standard deviation, or rate or ratios, whatever you are getting from the sample, as it is, we are show the population is called the point estimation. Whatever we are getting from the sample, whatever results we are getting through the sample, as it is, we are represent to the population is called the point estimation. But interval estimation is the exactly proper one, because we are estimated through 95%, minimum 95% confidence. That is called confidence limits. So we are using the formula. So for if it is continuous variable like a quantitative measure, we can measure mean and standard deviation. I showed you how to calculate the standard error. Standard error is the standard deviation divided by root of sample size, root n. So you'll get the standard error. Now you can apply the formula, the mean plus or minus the, I told you the alpha error, the value you'll get 1.96 for the 5% for the large sample, or you have to get from the table value for the small sample, the alpha error value. Then based on the standard error, we are going to calculate two limits, plus or minus. One is the low control limit, another one is the upper limit. So that's called control limits. Okay, that using the control limits, we are using that. What is the interpretation of that? Using that, we are getting the one lower value, one upper value. Now our sample mean, when you do with your population, okay, 95% of the chance you will get within your result should be within that range. Only 5% of the chance you are getting below that value or above that value. But 95% of the chance, when you are doing with some other sample from the same population, or you are doing the entire population, you are doing the statistical mean or standard deviation, that mean will lie within that control. That is the meaning of control limits. Okay, enough explanation.
Yes, sir. Yes, sir. Thank you, sir.
Any other questions?
No, sir.
Thank you. Thank you,
Okay,
sir, for your excellent presentation in a simple way, and also for effective way of making us to understand about the statistics. Now I call upon Manju Rajora ma'am to give her feedback about the session.
Just a minute. I'll share the PPT. Just a minute.
Thank you, ma'am. Thank you, Dr. Amalraj. It was such a wonderful presentation. It was such
welcome.
a elaborative presentation that students, they are commenting that rarely we get such kind of teachings, and you should have been given more time rather.
Yes, next time.
So
With
thank
the
you
more
for,
time, I'll explain very clearly each method.
yeah, your explanation was so much to the point, and rather you told about like starting from the data till end of the, like, what groups, if they are one group, two groups, more than two groups, so what should be the data analysis plan in the in the inferential Wilcoxon or the Kruskal values for the categorical variables, or for the continuous variables it should be the T independent or T dependent. So I mean, you have explained it so well, and students are giving so good comments. uh Muthu sir, I think next time we should plan a proper data analysis
Surely, ma'am.
session.
Sure, we'll go ahead with the sir present. Next, we will plan. Sir, that time,
Even that, like the softwares, how you are use the software, because they are using the going for non-statistician for the analysis. I am reviewing many article, or when I present that the presentation of the Viva, PhD Viva, really they are used here non like not at all appropriate, not appropriate methods they are using. So that's the thing. They must know. Even nurses, they can use now. SPSS is the free. I think 1 month or 3 months of free softwares are available, and many
Yeah.
software even are. So I can teach them how to like get the results from use the statistical method also. So there are many way. Yeah.
surely, sir. Thank you. We'll go ahead
Yeah.
with the next session. What Manju madam says, surely we'll go ahead with those sessions also, ma'am. Manju
Yes.
ma'am, please continue.
So one of the participant, like Amala Jesu, she's asking how to use the software. We want to know, sir. So Amala, maybe in the next session,
Yeah.
whenever we are planning, we'll be able to answer your all sort of questions.
Yes.
So thank you, sir, very much for such an elaborative presentation. We are rather, privileged to be, be listening to your presentation. Thank you very much, sir.
You are welcome, ma'am. Thank you so much for your good comments.
Thank you, sir.
Thank you, students.
Thank
You
you.
are listen nicely. Thank you for your comments. Thank you so much. See you.
Now I
Bye.
request Dr. Manju Rajora ma'am, Chairperson Research, to give vote of thanks.
Manju ma'am, over to you only, ma'am.
Yeah. Yeah. So thank you, ma'am. It's my proud privilege to propose the vote of thanks. I extend my heartfelt thanks to our patron, Dr. Survesh Narula Khanna. She is the national patron for the NSS Society. My heartfelt thanks goes to Dr. Vimla Kapoor, the national advisor of NSS. And my heartfelt thanks to the Dr. Binu Joy, who is National President of Nursing Scholar Society, and our beloved President of the NSS Karnataka for Siddhya chapter, Dr. MP Chavadanawar. Sorry if I mispronounce. But and then I also extend my great heartful thanks to the organizing committee members, Dr. Muthu, Dr. Anand Muchandi, Secretary NSS Fordia Chapter, Dr. M. Melvin David, Co-Chair Research Committee NSS Fordia Chapter, and Mr. P. Srinavasulu, Webinar Coordinator, Med Analytics. I also extend my thanks to the speakers, starting from Dr. Anu Goba, Professor, College of Nursing, Amity University, Gurgaon, Haryana, who introduced about the concept of nursing research and evidence-based practice. Then I also extend my thanks to Dr. Lata, Associate Professor, College of Nursing, AIMS Kalyani, West Bengal, who is now heading for her next positions that she will be principal of College of Nursing of another AIMS. Then she expressed about the literature review and critical appraisal of the research. Then on day second, we had the session by Dr. Anu Grover on the research methodology and data collection techniques in nursing. She explained such a big topic in such a short time span, which was really wonderful. Thank you, ma'am Anu. And then the very interesting session, that is statistical analysis for nursing research by Dr. Amarit Stone Anthony, who is professor in biostatics cum senior scientist led Apotex Pharmaceutical Company, Toronto, Canada. And I also extend my warm thanks for the moderator, Professor Dr. Deepti Shukla, who is principal, Samarpan Institute of Nursing and Paramedical Sciences. Another moderator, Professor Salome S., Principal, Rajiv College of Nursing, Hassan, Karnataka. Then Professor Dr. Prasanna Deshpande, Vice Principal, SDM Institute of Nursing Science, SDM University, Harvard. And last not the least, the participants who, with so much enthusiasm and zeal, attended this webinar, and they asked so many questions. They still want to attend the further sessions on the analysis part. So thank you very much. Thank you very much, participants, and thank you, everybody. I hope that I have included everybody. So please pardon me if I missed somebody in this vote of thanks.
Madam, actually, you missed yours only, ma'am, because you're also a part of moderator, actually, and even
And my special thanks to the powerhouse, the mitochondria of the NSS Karnataka Forsythia chapter, Muthu sir. I think he deserves a big round of applause for everybody. Thank you,
Sir,
Muthu
like,
sir, for
thank you,
conducting
ma'am.
and making this event successful.
In future also we'll be planning, ma'am. Like as the
Yeah.
time goes on, we'll go ahead with those things. Even I'm very thankful to Melvin sir also. Every day, with me always he was there actually. And you
Thank
are
you,
also
sir. Thank you so much.
you are
My
all
pleasure.
entire team. Yeah. Just please go ahead. Anything you wanted to? And our
Nothing,
entire
sir.
Forsythia team, Karnataka chapter. So always they are there with us, and a special thank to our Divya madam. Always she always be there with us. Our master of ceremony whenever we call. Even Somsekhar sir, Mr. Anand, Mr. Bharat, Mr. Praveen Paret, Satish Nadagaddi, all the executive teams of Forsythia chapter Karnataka. I am very thankful to you. Melvin sir, anything you wanted to add?
Nothing, sir. It was really, good time we had past 2 days. Very knowledgeable sessions we
Yeah,
had,
really.
and all of stuff with the research thing in our mind. So with this, we'll conclude this event, and hopefully with such another beautiful event, we'll meet you all again. That's what I could see, sir.
Yeah, really, that is true, sir. In future, we'll be conducting that already.
Sure.
Manju ma'am, what she suggested, no? Surely we'll go with other topics. Surely we will be
Sure,
planned
sure,
very soon.
sure.
Somsekhar,
Yes.
anything? Somsekhar, anything?
Thank you, NSS. Thank you, Muthu sir, and all the resource person for giving wonderful session and informative and interactive sessions. Thank you, one and all.
The last. Yeah, madam, we just conclude the session. We'll end it. Just conclude the session.
Thank you. Thank you very much. Thank you all the participants who have joined for the session. I thank you all the resource persons who has made this conference a wonderful success. Thank you. Thank you very much.
Thank you, everyone. And one more thing, the whatever PPT presentations and recording what you are asking for, it will be circulated day after tomorrow. So I think yesterday only we have, I think, communicated in the WhatsApp group also. All these data, whatever PPTs and even recording, this today's recording also will get by tomorrow. Thank you.
Thank you all.
I
Thank
think
you
we
all the
can-
participants as well.
Yeah. Amalraj sir, thank you so much, sir. Anu ma'am? I think Anu ma'am also
They left, sir.
right now.
Okay, sir. We'll end the session. It's already
Yeah,
time.
we will end the session, sir. Yeah. Thank you.